You always want to use the 6 rights of medication administration. So you want to have the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So I'm going to wash my hands. I'm going to go and look at my physician orders and my medication administration record. For my patient Skip Rocker, there is a Pneumovax 1 milligram intramuscular due now. The vial contains Pneumovax 2 milligrams per milliliter. So when doing your math, you have 2 milligrams per 1 milliliter equals 1 milligram over 0.5 milliliters. So I'm going to come into my medication room. I'm going to pick out my Pneumovax vial. I'm going to check for any cracks, particulates, and expiration date. With a multi-use vial, you're going to break down the date, the time, and your initials when you open it. Usually good for 30 days unless the box says otherwise. So when picking out your syringe and needle, you want to do it based on the volume and type of medication that you're giving and the patient's muscle mass. Okay, so we're going to uncap our vial, clean the top of it. We're going to pull out our needle, and I picked the 3cc 23 gauge with 5/8 needle. So when uncapping it, you want to do it without touching the needle or the shaft to anything, and you want to place your cap on a clean surface. And you are going to draw up 0.5 milliliters of air. And you're going to inject it through the center and the rubber on your vial. You're going to inject your air, flip it upside down, and take out your 0.5 milliliters. And if you have bubbles, you can just kind of firmly tap them to get them out. Going to flip it back upside down, pull out your needle, and with a one-handed technique, you're going to scoop it up without touching anything to the tip of the needle. And you can secure it at the hub. So we're going to go into the patient's room. I'm going to introduce myself. I'm Abby. I'm going to be your nurse today. I'm going to check for 2 patient identifiers. So I'm going to look at the wristband and ask their name and date of birth. I'm going to explain the procedure and the medication. So I have a Pneumovax injection that's going to go into your deltoid muscle. So when finding your deltoid site, you are going to uncover your patient's shoulder all the way. You're going to search for the end of their acromion process and place 2 fingers there. Then you have your V that you're going to make, and you're going to put it in the center of your V. So I have my patient here, Mr. Tomato. And you're just going to have them place their arm at their side, or you can kind of rest it on a firm surface. I'm going to apply my gloves. Going to clean the site with my alcohol wipe. So you want to kind of start in the center and go outwards and allow for time for it to dry. You're going to uncap your needle parallel to your body. You're going to hold the skin top with your finger and your thumb. You want to inject this at a 90-degree angle quickly and smoothly into the site that we picked out earlier. And you want the whole needle in there, covered. So this is where you would aspirate for blood. You just pull it back. If you get blood return, you want to remove the needle, put it in the sharps container, and drop new medication and try again. If there is no blood, you can inject this medication slowly, about 5 to 10 seconds. And you're going to remove the needle smoothly and slowly. You're going smoothly and quickly, not smoothly and slowly. You're going to put your needle in the sharps container. You can pat dry and put light pressure on. Use a gauze pad. And you may also put on a Band-Aid if you have one. So at this point, I'm going to go and document what I did on the MAR. So I gave the Pneumovax 1 milligram intramuscularly in the right deltoid at 0805. I'm going to put my initials. And I have my calculations from earlier on the back.